as the speaker, and then hand it over to our lovely speaker.
Thank you.
Yes.
Welcome.
Thank you.
Yeah. Hi, everyone.
I need my phone.
Hello.
Sorry.
That's okay.
Oh, okay, go. Great.
Thank you for having me. My name is Ryan Schumaker. I'm a physical therapist. Thank you for inviting me.
Yeah.
I thought I would just talk a little bit about who I am, what I do, and I really didn't know anything about you, so I was going to open it up to your questions because I feel like we're kind of all on this journey together learning about this. But I've been a physical therapist for 24 years. I obviously work for Freighter. I've been a lymphedema therapist. I think about 15 years I specialized. And then obviously with my lymphedema work, I was getting patients that were sent over that I was realizing, hey, this isn't just lymphedema. So I started doing some research and realized that it was lipedema. And then I put myself on the Lipedema Foundation. Are you guys familiar with the Lipedema Foundation? It's fabulous. It's a website with great information, evidence-based research. And if you are looking for a physical therapist or an occupational therapist, uh, a lymphedema therapist who treats lipedema, you can go on the foundation website and find therapists. So I put my name on there, not realizing that people would look me up and find me. And it's been great. I have had quite a few women find me that way. I'm sure you guys have realized that you have to do your own research. You have to be your own advocate. There is not a healthcare professional out there that's really advocating for you, really knows about it. So that's why in this diagnosis, people are coming to me and finding me because you guys are so proactive. You have to be. You have to be. There's really no healthcare provider out there that specializes in this other than lymphedema therapists is what I find. There's really no doctors that this is what they specialize in. There's no doctor that specializes in lymphedema, which amazes me. We have a cardiologist who specializes in the heart. We have a dermatologist who specializes in the skin. Who specializes in lymphedema? One of the most important systems in our body. Nobody. The specialist becomes your therapist. So I'm honored to do what I do. I always say it picked me. I did not pick it. So it's funny how life opens those doors. You walk through it and you realize that this is an amazing population, an amazing group of people. It keeps evolving. So like I said, I really just kind of started with the lipedema component of this within the last couple of years. I realized that, and you guys, I know you all relate to this. There's not been one woman who's come into my room, and you know the room, who hasn't just started to cry because it is a very, very emotional journey. And then finally you meet this healthcare provider who's nodding her head and is just like, yes, yes, yes. And you're like, oh, I don't have to teach someone about it. This person knows about it. So I really recognize the whole person, the emotional, the spiritual, the physical, the mental, all of those components that go along with having lipedema. And then I realized that physicians have no idea what it is. I will share with you that physicians get 1 hour of education on the lymphatic system in med school. That's what they get, 1 hour. And I know that this is true because I also have physicians that shadow me, and I'm super excited. Freighter has a great residency program where physicians can, part of their residency is to shadow physical therapists and occupational therapists. So they always like to come in and see me and learn about the lymphedema. So I ask them, like, what are you getting? 1 hour. 1 hour. And they don't know what lipedema is. They think it's the same thing as lymphedema. So I have, and Vicki can attest this, I have a whole wall of bins and pamphlets. So I give every single physician a pamphlet on lipedema, and I did have one hand it back to me. And I said, oh, no, 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 no. This is for you to take. If you have any questions, you let me know. So why am I telling you this? I want you guys to know that I'm advocating for you. I'm advocating for this diagnosis, for this disease, and I'm trying to educate. I really am trying to get the word out there. I also just did a lymphedema education course to the lymphedema therapist at Freighter. So it was the first time we did this. I'm trying to get that education piece out to the treaters And I'm just really working on that awareness. So when Vicky asked if I would come and speak here, I thought, absolutely. So that's just a little bit about me and where I come from. I also do general orthopedics too. So knee pain, back pain, all of that. But I wanted to open it up to you guys as to if you guys had questions for me, because this is your time.
Do you like, for me, I can't go to people unless I can use my insurance
Yep.
to see them. Can we, as people with lipedema, go to see like physical therapists on a regular basis through insurance?
I have not had anyone have issues with their insurance. Now, it's important to understand with insurance, you have to have functional deficits in order for insurance to cover it. So it can be challenging for like that maintenance part to keep coming, which always feels good to do. But you have to have functional deficits and goals to be working toward. And once those goals are met, that's when the insurance is like, you can go do this on your own.
Okay.
So that might be where maybe a personal trainer comes in at a gym, or you keep going to the gym, keep working on your gym membership. I always tell patients, and you're not quite at the end, but I always say, like, I'm still your advocate. I'm still here. Even if insurance isn't covering anymore, you reach out to me with questions. With my patients with lymphedema, it's quite often that they need what I call a tune-up. So if it gets to the point where they can't manage on their own, I always tell them, come back, come back. This is chronic. You're dealing with this the rest of your life, and I'll be your therapist to help you the rest of your life. So that's not uncommon. I haven't had any issues with insurance covering me.
Right.
Yeah, I really haven't. Good question.
And what do you do on a daily basis then? Do you do like MLT?
Yeah.
That kind of stuff?
Yeah.
Yeah.
Yep, MLD, I do it all day. My hands are feeling it. Yes. A lot of MLD. We have a warm water therapy pool too where I work. I think aquatic therapy can be fabulous. The hydrostatic pressure of the water is amazing for lymph movement. I think it's a great environment just for joints. So some of my patients want to get in the pool. We can do some pool sessions. I do exercise mostly with my lymphedema. It's hands-on. Compression, pumps. I do believe in pumps. I think pumps can be amazing. Great adjunct because again, this is chronic. So I always think of, I'm teaching my patients how to be their own physical therapist, right? I'm giving you my knowledge without the student loans. So take this knowledge, figure out what you need, a good program, and then go and do it.
I tried to get a pump not long ago and I had a fitting with BioTab.
Okay.
And I actually had the machine already and I was like, even if you could just give me like a new suit, that would be great. And it was like something like $900. Is there any way to like work with a person like yourself to like get insurance to cover more of that?
So typically insurances do require that you have a therapist that you're seeing to document the numbers. I
Okay.
typically don't work with BioTab too often. I usually do Flexi Touch, Tactile Medical. Yeah, that's the one. And their coverage for the lipedema pumps has been really, really
Yeah,
good.
they covered mine.
Yeah,
What's the name again?
it's Tactile Medical. Yeah. Yeah. T, yeah, my patients have had really, really good luck with it. I haven't had, trying to think. There's sticklers with head and neck, but that's just the diagnosis
Go up.
and insurance. Yeah.
Which I could, it's the one that go all the way.
Yeah. I mean, it's so sad how insurance dictates my life. And right. And so like I just know every healthcare provider out there, like this is the thorn in our side. And just being in this profession as long as I have been, I see the change. I mean, it's not uncommon now that I get 4 visits approved. 4. 10 years ago, that didn't happen. So we feel that frustration. The time, I will share with you, the time that your healthcare providers are on the phone with insurance companies and documenting is pretty insane. So just know that we feel this too. We're on your side. And we're doing a lot behind the scenes to try to get that covered. But the Flexi Touch, I really haven't had any issues with that being covered for the lipedema. It's been really, really good.
Do you prescribe it then?
I recommend it. So if I recommend it, what I usually do then is reach out to them and then they come to the clinic during an appointment that you'd be seeing me so that you can try it. Because I never want to pressure. Like, and I don't get any kickback from this. My whole purpose is to make your life better. So and I think I'm giving you tools. I want you to have those tools in place so that when you're done with me, you have a plan in place. So they'll come to the clinic and do a trial. And if you like it, they handle all the insurance. They get the prescription from the doctor, take care of that. I'm out of it. I'm busy treating. Yeah. So it's a great working relationship. I've used them for, gosh, years.
So you have to have the doctor, let's see.
So no, what they'll do is because if you were coming to see me, you would have a doctor's referral, go see Ryan for lipedema or lymphedema or lipolymphedema. And then I would set that up with Tactile. Then they get the prescription signed by the doctor. You don't have to do anything. I don't have to do anything, which is great.
Yeah.
It's simple. I like easy. Yeah.
They came to my house.
And they can do that too. They can come to, but insurance companies want it through a therapist, is what I'm finding. They want that documentation. They need the numbers. They need the measurements. Did you?
Yeah.
Okay.
Doctor, yeah.
So he or she had the measurements?
Yeah.
Okay. Yep. That's good. But like your primary care doctor, it's not good.
Yeah, they're not gonna go.
You have to refer me to that.
Mhm.
So in order to have ongoing therapy then with you,
Uh-huh.
would a functional capacity evaluation be like a part of that?
That's a really good question. Were you talking to Stacy?
No, I just,
Oh, did you? Do you know Stacy?
it was through Freigert and it was through like an OT PT
Yeah.
type thing.
Yeah.
And she was lovely. She was an older blonde lady that gave me my test. And I don't remember where it was specifically.
Must have been the North Hills Clinic because that's where we do our functional capacity evals.
Yeah, it was
Yep.
like a whole bunch of like
Yep.
weird shit like
Yep.
all over the place and
Yep.
yeah.
Yeah.
Like lift this and move that and
Yep.
do this and that. Yeah,
Do you know Stacy? Who I'm talking about?
I don't think so.
She's in this group because she texted. She
Yeah.
she texted. She texted me. She's like, "I'm so sorry to miss your presentation. We got to connect." She's a former PT, and she was actually working on coordinating a functional capacity valve for lipedema.
Okay.
And I haven't talked to her for a couple of years. I can
Do you really even have anything?
Right. Right.
I need like for my packet.
Yes.
That's something that packet sometimes.
Yes.
use.
So let me explain to the group what a functional capacity eval is. It's done by a therapist, and it's a 2-day test that looks at how,
FCE.
FCE. It looks at, your heart rate, your blood pressure, your vitals, and how well you're handling lifting or walking stairs. So it's really assessing those. You can't change your heart rate. You can't change your
Right.
blood pressure, right? So it's looking at those vitals. It's looking at your strength to see what your physical capability is, usually used for a job. So let's say I needed to work on a factory line and I had to stand for 6 hours, but maybe I just had ankle surgery, for example. Could I do that job? I would have to go and do a functional capacity eval to prove, okay, no, I can't do the job anymore. Or I can't, they're used more for job related things. The therapists that do them have to be trained. I'm not trained in them. Don't really want to be trained in them. But the ones that are great. But it's rigorous, wouldn't you say?
Yeah, it took probably, I'm gonna say an hour and 10 minutes, an hour and a half, something like that. Like it was like a lot of
Yeah.
little things. Like they tested like my fine motor skills
Mhm.
and like my larger motor skills, like my walking, my stairs,
Mm-hmm.
and lifting and like
Yeah.
every movement you could possibly make.
Yes.
Yeah.
Yeah. So it also is used to really determine if someone might not be telling the truth of their ability to do a job too. Yeah. They can be quite expensive. Good. That's great.
Yeah.
Usually the employer, I believe, has to pay for it. So I'm not 100% certain on how that, but you should connect with Stacy because she was working on creating a functional capacity valve for people with lipedema.
We will follow up with that.
Yeah.
But yes, it's my doctor that like put in an order.
Wow. Okay.
Because of my packet and stuff or whatever, Dr. Cardona, who I sing
Oh, yeah.
to this guy.
Yeah. Any other questions? Yeah.
Do you only work with certain insurance companies?
Mm-mm.
Okay.
Mm-mm. Take them all.
I have Anthem now, and
I take them all.
one time when I was on Medicaid for a while, and I got to see Dr. Gosset,
Uh-huh.
and he
Yeah.
was one of the ones who knew about lymphedema.
Yeah.
So I knew what it was, everything.
Yeah.
That's great.
Yeah. I see his patients.
Yeah, and then I saw the therapy that her comes from was Lynette.
Lynette?
On the
Trune?
yes.
Yeah.
Yes.
Great.
She was great.
Yeah.
And I got the pulse from tactile. But once I was off of that and I had other insurance, I couldn't go through Freighter.
Really?
Anything in Freighter. And
Oh.
my next appointment with Dr. Gosset was like the next day I was gonna go for my ultrasound, everything. And he was on the list for my insurance and location and everything. The day before, the office lady called me and she's like, he's not in network. I said, what? I started crying. I started crying on the phone because it was like everything was all set and
Were you able to find a new provider?
I haven't done anything since.
Okay.
Problem.
Yeah.
I haven't followed up with anything.
I know it's tricky. These insurance companies really rule who we can see, who we can't see. I mean, personally, I take all insurances. I work for Freighter, so I have to go to Freighter. So if I went to someone at Aurora, I'd be paying a lot more money. So I totally understand that. You want to stay because it gets expensive. Healthcare is expensive.
But the insurance company told me he was on the list.
Hmm.
And then the office gal checked for whatever
Oh.
reason. I don't even remember what it was like. Sarah was so upset, but
Yeah.
said I had to cancel everything because
Ugh, I'm sorry.
in network but not.
Yeah.
It was just.
It's a mess.
So,
Don't give up. Take a deep breath.
yeah.
You all are experts at your research. So just keep plugging along, or you call your insurance company and you ask them, who is in network? Who do I see for this?
Yeah.
And you keep bugging them until they give you a resource.
And so since there are no lipedema doctors, but then what I would ask for a vascular doctor.
Probably.
Because my old vascular doctor is also not covered on my current insurance. So
Yes.
I'm just gonna be, I've had to find a new one, that's fine, but how can they not cover vascular?
Like a really good CCP that can do referrals and stuff like that too.
Yeah.
Yeah, that's tricky. That's tricky. Yeah, ask around.
And actually,
Yeah.
the nurse practitioner from my PCP recommended Freighter, and that's,
Yeah.
and that was with Pro Healthcare. So,
Yeah.
so that worked out good, but
Yeah.
not anymore, so.
Ugh.
So is there something that you have found that we can do at home that you have found to be pretty effective?
For what?
Well, I don't know, treatment, I guess.
So okay.
Okay, that's a broad.
It's a broad question, but there's probably a broad answer to it. So, there's not just one thing that you do to take care of yourselves with women with lipedema. I say this every day. I'm a physical therapist, so I believe in physical exercise. And honestly, in where the research is, that's so amazing and powerful. So I think I hear that it can be discouraging when you put all this work into your exercise and you're not seeing the number go down on the scale, you're not seeing those thighs get smaller. Right? Anyone going through or past menopause can relate, let me tell you. But I really stress the importance of exercise, not just for the number on the scale and not just for the waistline. The benefits, the mental health benefits, the benefits for our heart, for our lungs, for our skin. Like there's not one system that it doesn't benefit. So I think we can get caught up in we're not seeing what we want, but we're also not realizing the extra benefits of exercise. And that is probably the most important thing that you can be doing. So I really, really do recommend a good exercise program, something you enjoy doing. Aquatics is great. Strength training for women, let's be real. Strength training for every single woman is the most effective and important research-backed exercise we can be doing for our bone health, for our muscle health, for our brain health, for Alzheimer's. So we all should be lifting weights, every single one of us. So I really, really recommend.
More weight and more reps or.
So you're going to hear varying things on that. I don't say heavy because I think heavy can be scary, right? Especially if we've never lifted. I don't lift heavy. The most I lift is 20s. I have 220s. I lift from home, but I have definitely added strength training to my routine. right? Heavy for some could be, 100 pounds. So I really say start small, see where it can go. But something is better than nothing. And we sure better we have muscle. I mean, we're talking about a fat disorder, right? But underneath that is muscle, and we have to be taking care of that muscle. And I really do think that if you focus there, you're going to see some results that maybe you haven't seen. I really believe it. Definitely exercise to answer your question. Nutrition. I talk a lot about nutrition and what the latest research is saying about nutrition and lipedema. I talk about compression, and I'm still like, there's no magic compression. There's no, right. That's a struggle. We're on the,
Not hot.
right. We're on the struggle bus with that. So I do talk a lot of, we go there. The pump is a nice adjunct. Self massage, self MLD. So really just trying to empower. I just really want to empower my patients to do as much as they can for themselves. If you have, is anyone familiar with Lipedema Mamas podcast?
Yeah.
Yeah, I really like them. They're great. I listen to them a lot for education for myself. There's two gals out of Texas, two mamas, and they both have lipedema. I like them because their podcast is about a 30-minute podcast, so you can go for a walk and listen to them. They do have a lot of research and physicians on their podcast talking about research, and there's quite a bit actually in this area. And they've really kind of opened my eyes to what's out there. And I do think we have to pay attention to the research, because we can hear the gimmicks. And I heard you mention the vibration plates and like the TikTok stuff. And I get asked all of these questions all the time. And we want the quick fix. We want the easy thing. But a lot of the stuff is not research based. So I like the Lipedema Mamas. See what you think. They're very knowledgeable. Wouldn't you say? They're funny.
Yeah.
They're down to earth, right? It feels like you're talking to your two girlfriends. That's one that I do like and recommend. Mm-hmm. Yeah. Yeah. They got a little Southern twang too.
Yeah.
Yeah. Yeah. And they were talking about a whole lipedema conference in Europe. I didn't even know that existed. There's a lot.
In Spain, I follow a gal, she's from Australia, but she
Yeah.
went to Spain for her surgery at the end of the World Conference.
Well, Europe is very, I'm sure you realize, way leaps and bounds ahead of us here in America. Like that's really where Australia and Europe, Germany, really far ahead. That's where lymphedema therapy really started. Their approach is much different here, but then insurance and funding is different. You go to a country that has universal healthcare, it's a whole different story. So people come and ask me those questions, but I'm like, we live in America, so we don't have unlimited access, and you can't go to the 2-week spa and get your 2 weeks worth of MLD. It just doesn't work that way. But it is interesting how different it is over there.
Yeah.
Yeah. Did that help answer your question?
Yeah.
Okay, good. Good. Yeah.
Are you on the main campus at the?
No, the big house, as I call it. No, that scares me. I am at the Menominee Falls location, right by the WAC there. Yeah, the orthopedic clinic there. Yep, Menominee Falls.
So,
Yes,
what's your last name?
Schumaker, SCH. I'm a girl. I know, that's what every patient says when I go out. Yeah. Mhm.
Other questions?
I have one.
Yeah.
So I've been blessed with both the edemas.
Okay.
Since you have a lot of training in both, does having just MLD kind of like work with both, or is there a separate technique?
So explain a little bit more. So
I have lipedema and lymphedema.
you have lipedema and lymphedema. So you have lipolymphedema.
Correct.
Okay, so MLD is going to target lymph fluid. Okay, so it's going to treat the lymphedema. There's not necessarily a massage that's going to treat the lipedema, which is the excess fat, right? The only way you're going to get rid of that truly is the liposuction. Okay, so I will do lymphedema on someone that maybe presents with lipedema symptoms. Usually they go along with lymphedema. They usually have both, is what I find. So sometimes it's very hard to determine, well, what do you have? Well, let's try this and see how you feel. So if we do a whole series of lymphedema treatment on your legs and you get up and you're like, oh gosh, like I can lift my legs. They're not as heavy. They don't feel like tree trunks anymore. It's a pretty good indicator that you have a lymphedema component. So the MLD is going to address that.
Well, that's what I've been getting, but I just
Yeah.
didn't know if.
Was there anything else to add, you mean, to the lymphedema or the
I mean,
MLD?
you can run me down all day long, but
Yeah.
take pain and swelling away.
Yeah. Yeah, it really will. And it helps with the hypersensitivity too.
Yeah.
Right? When you're getting that lymph flow, you are bathing those nerves with good nutrients. You're decreasing the pressure off the nerves, so less numbness and tingling. So, I mean, there's great benefits to it. I see it every day.
I just didn't know if there was a difference in
Mm-mm.
approach, I guess.
Not that I'm aware of.
Okay.
Mm-mm.
Yeah, I don't want to take my MLD away. I just didn't know if there was a
Yeah.
component that she
No.
could live in.
No, not that I can
Works for me.
think of. No, I mean, I do educate on some dry brushing. There's not a ton of research on that. For some of my patients, I usually go more the lower body for that. And it's mostly for my patients that maybe can't reach so far down. So it's an option, the dry
We
brushing.
did that with, it wasn't a thing. I shouldn't say a thing. It wasn't a winner for me.
And sometimes it's not. Again, I just
The
think
kids
it's
did.
one more tool in the toolbox to try.
Right.
Right? When you're desperate, like what's going to work? Well, maybe this will help a little bit. So,
Thank you.
yeah. You had great questions.
Like a Theragun.
You can certainly give it a try. They can be aggressive.
Yes.
Okay, so the one yeah.
It's got the fascia. It's that one of those things that helps.
Yeah, like go to Costco at Christmas, they're $70 and they just go. So, yeah, you got to be careful because you already have that hypersensitivity.
Yeah.
So that tends to be aggressive, even on the lowest setting.
Does it break up the fascia?
Well, I use it probably more for like muscular trigger points with my patients. I do myofascial release
Mm-hmm.
all the time. So I do a lot. So I have a lot of manual therapy training. So you won't find me just doing like MLD. I'm incorporating a lot of different techniques in my patients. I always say my hands have a mind of their own. They just do what they need to do. You can attest. They just kind of find it and do it. Is it your answer? Does it help? Go try it.
Yeah.
It just can be aggressive. So I don't.
Like part of me is like, worse.
Well, that's the other thing. What about cupping? Have you done any cupping?
It's done a little, actually, I did go for an MLD massage where she did a little bit.
Yeah, I love cupping.
Hurt.
No, it didn't hurt.
Depends. Stuck in the
Surgeries. And it,
We've done cupping, right? Haven't we?
so it's.
We did do cupping. Okay.
hurt. It's hard, but it broke it up.
It's
And it-
great for scar tissue.
And it like, my healing between the MLD and like the cupping that they did, it was like, I don't know, it was so much faster. Like,
Yeah.
I was really, really shocked at how I feel.
I heard that vibration helps with like getting lymph moving, and everything, but it doesn't like
I
help
feel
with
like vibration plate
thing.
only helps with pain, like it relieves.
Okay.
Pain.
Yeah,
I don't know that it does anything else.
yeah, because like my vibration plate, if I am really sore, I get on it and I feel like way better afterward, but.
Okay.
Yeah, but it's not making anything change.
Right. Just gets.
Right.
Yeah.
No. And you have to understand too, it's a passive treatment, right? In order for the lymph system to move in our body, the lymph fluid, we need to actively move. It doesn't have a pump. So I talk to my patients all the time. We're sitting here, our heart is pumping our blood. Like we're sitting here, we're not doing anything, but our blood's moving. But our lymph system is not moving too much. It moves very, very slow. If we want that lymph fluid to move, we got to be moving ourselves. You need that muscle contraction. So the vibration plates, it's passive, right? You're usually sitting or standing. It's doing that action for you. So again, I say to patients, I would prefer you to maybe do something more physical and go for a walk, a 20-minute walk. You're going to get way more health benefits from 20 minutes on the vibration plate. However, if you need it for pain control, if you need that placebo effect, if it makes you feel better, fine. But that should be done after you do your exercise, after you do all your other things. Well, I mean, time-wise, I was thinking more time-wise. Like, you're right, prioritizing. Like if I got 40 minutes, I want to get a good workout in. I don't want to spend half that time sitting on a vibration plate. So I would prioritize more active exercise over that. That can be an adjunct if you want it to be. The research just isn't quite there. I tell patients that, like, get it if you want, but I can't tell you it's going to be amazing based on what the research is.
Sure.
Yeah.
That is my weight while I'm on.
There you go. Had a gal tell me, she's like, I'm sitting there, I'm doing this. I'm like, okay, you do you. Do it. Go for it. Yeah.
Is that the same concept then with the suits, the compression?
Great question. No, because with the pumps, it's inflating with air and it's sequential. So it's mimicking the manual lymphatic drainage and the flow that we use to mobilize fluid. So there's actually quite a bit of research on the pumps, fabulous research. Tactile Medical has a great research on lipedema and their pumps. It's really exciting. I have a whole brochure. It's very medical, but the research is out there. So no, the pump is very research backed. That's why I recommend it.
You feel like it's like.
You totally could, and I could, yeah, they would totally come. Yeah, it feels great. People love it. Again, it's passive. It is passive.
I
And I
have a
took-
hard time sitting for.
Yeah, a lot of people do. A lot of people do.
By the end of the house.
Yeah. Yeah,
Especially more. I can recommend trying a little bit.
fine.
I sit upright like I'm usually either watching TV or reading.
Yeah.
So, and I put like a cushion, little cushion under my knees
Fine.
and that, but after I'm done, if I don't, which I found, I talked about this last time. I didn't realize I should have done my MLD before putting my pumps on. And all the time I was like, I felt like when I was done, I was like, oh, I feel like I'm
Yeah.
choking.
It's very important that you do that, what we call that proximal clearing. So you're deep breathing, clearing your terminus, clearing any nodes. You have to do that beforehand. You have to create a space and movement of the fluid here for, yes.
So it's kind of like doing it like as my pump is starting.
Yeah. Yeah.
Whatever.
Spend a couple minutes doing it.
Too.
I think you're fine with that because usually the program is pretty lengthy.
Yeah,
So as long as you get in some of that pre-work,
yeah.
you'll find the benefits of the pump to be much better.
My vibration plate, and I'm like doing it on my vibration plate, and then I get into my.
That's great.
That are like killer good now.
Well, that's great. That's a good idea. Yeah,
Do you work with patients after surgery too? Is that?
I do. I've only had 3 that have had surgery in my career.
That's because it's so hard to be.
Yeah, I know. Don't I know it? I know. And the first patient was years ago, and I spent years writing letters and like the amount of, and this isn't a complaint. I would do this for any of my patients, but like it was a lot of work for me. I didn't mind it at all because she ended up getting her surgery. She got her arms and her legs done. It was rigorous, is what I would say.